Welcome to the deep dive. You're joining us today as we really get into something quite specific but pretty important: congenital spinal and vertebral malformations.
That's right. We're talking about developmental issues with the spine, things that are there right from birth or, very early on. We'll be looking at insights from medical texts mainly.
Yeah, and our mission today is to give you a really clear understanding of these conditions, what causes them, how they actually affect an animal, and, well, what it all means. Sort of blueprint gone slightly wrong, right?
Exactly. It's about understanding those deviations.
Okay, so let's start right at the beginning. What exactly are congenital spinal and vertebral malformations?
Well, simply put, they're defects in how the spinal bones, the vertebrae, and related structures develop. And the key word is congenital. They're present at birth, or maybe become apparent in the first few weeks.
So not something caused by an injury later on, it's developmental?
Precisely. It originates during gestation, yeah.
Okay, so how? How does this actually happen? I mean, spinal development sounds incredibly complex. Where do things go off track?
It is complex, and the texts point to a few key areas. One big one is right at the top, the connection between the skull, specifically the occipital bones at the back, and the first two neck bones, the atlas and axis.
Right, the C1 and C2 vertebrae.
Exactly. And there's a specific part of the axis, the odontoid process, that's crucial. If these don't form just right, you can get something called atlantoaxial subluxation.
Subluxation,
Does
so
it?
like a misalignment.
Yeah, basically the joint isn't stable. Those top vertebrae don't sit together properly. And that's dangerous because it can compress the spinal cord right there.
Wow, okay. That sounds critical, a bad connection right at the top.
It really is. And then, further down the spine, we see other types of anomalies.
Like what?
Well, there's hemivertebra, that's where only half a vertebra forms properly. It's sort of wedge-shaped. Then you've got transitional vertebrae, where a vertebra kind of looks like the ones from a different section of the spine. Block vertebrae are when two or more fuse together when they shouldn't.
Fused together, okay.
And butterfly vertebrae, they have this split down the middle, kind of looking like butterfly wings on an X-ray.
Interesting shapes. And what do these cause? Just a wonky spine?
Often, yes. They can lead to deformities like curves and instability. But sometimes, depending on the shape and location, they can actually compress the spinal cord or the nerves coming off it, though that's maybe less common than the instability itself.
Got it. What about way down at the tail end? Any specific issues there?
Yes, sacrococcygeal dysgenesis. That's basically the absence or only partial development of the sacrum and the tailbones and the bit of spinal cord down there.
So the very lowest part might be missing or underdeveloped.
Exactly. And this condition is often linked with other things like spina bifida.
Okay, spina bifida, that's a term I think many people have heard. How does that fit into this picture? What's the actual problem?
So spina bifida is fundamentally a failure of the vertebral arches, the bony rings that normally surround and protect the spinal cord, to fuse completely.
Like a gap in the back of the bone.
Precisely, a gap. And through that gap, sometimes the spinal cord's protective coverings, the meninges, can bulge out. In more severe cases, the spinal cord tissue itself might be involved in that bulge.
And that can happen anywhere along the spine.
It can, but it's often seen in the lower back. The sources also mention it can be associated with other issues, like abnormal spinal cord tissue development, that's spinal dysplasia, or even fluid-filled cavities within the cord called syringomyelia or hydromyelia.
Fluid cavities.
Yeah. And sometimes the only outward sign might be a little dimple or a tuft of hair on the skin over the defect.
A dimple is such a small sign for something potentially quite significant underneath.
Okay. And the last type you mentioned earlier was congenital spinal stenosis. What's going on there? Stenosis just means narrowing.
Yeah.
So congenital spinal stenosis is when the spinal canal, the tunnel the spinal cord runs through, is narrower than it should be right from birth.
And what causes that narrowing?
It can be due to the vertebral malformations themselves, like misshapen bones taking up space, but it could also be related to sort of abnormal skeletal growth patterns, or maybe thickening of ligaments inside the canal, or even extra bony growths, essentially less room for the spinal cord.
Okay, that makes sense. So we've covered quite a few ways development can go wrong. When these things happen, what are the main body systems that bear the brunt of the impact?
It's really two key systems that are intertwined here. First, obviously, the nervous system, specifically the spinal cord and the nerve roots branching off it.
Right.
And second, the vertebral column itself, the bony structure. The malformations affect the bones, and those bone issues then often affect the nerves they're supposed to protect.
It seems like these kinds of fundamental developmental issues, well, Genetics must play a role, surely. What do the sources say about that?
Yeah, you'd think so, wouldn't you? And genetics is strongly suspected in most of these conditions. The exact inheritance patterns.
Yeah.
Often, they're not fully worked out, kind of complex.
But sometimes they are known.
Sometimes, yes. The texts give a couple of examples. Sacrococcygeal dysgenesis, that lower spine issue that seems to follow an autosomal dominant pattern in some cases.
Meaning only one copy of the gene is needed.
Correct. And then there's a specific type of hemivertebra, the ones in the chest area, seen in German short-haired pointers that thought to be autosomal recessive.
So, needing two copies of the gene for that one.
Exactly. So, yeah, genetics is involved, but it's not always straightforward. Likely multiple genes interacting in many cases.
Right. So, if genetics plays a role, does that mean certain types of animals, certain breeds are more likely to have these problems? Are there known predispositions?
Oh, definitely. The sources are quite clear on this. Signal and breed, age, that sort of thing is really important here.
Okay, like who?
Well, for those issues right at the top of the neck, the occipital bone, atlas, axis problems, we tend to see those more in small breed dogs.
Interesting. Like Yorkies, Chihuahuas.
Those sorts of breeds, yeah. Then you have the brachycephalic breeds, especially the ones with the screw tails.
The flat-faced ones, bulldogs, pugs.
Exactly. French bulldogs, English bulldogs, pugs, Boston terriers, they have a higher incidence of hemivertebra, transitional vertebrae, block vertebrae, butterfly vertebrae. It's quite linked to that body shape they're bred for.
That makes sense. Any others?
Yes. Manx cats are kind of the classic example for sacrococcygeal dysgenesis and spina bifida that's linked to their tailless gene.
Right, the Manx cat.
Weimaraners have a known predisposition for something called spinal dysraphism, which is related to spina bifida. And for congenital spinal stenosis, the narrowing, Doberman pinchers, and also chondrodystrophic breeds.
Contro. What's that?
Basically breeds with inherent cartilage development differences, often leading to shorter legs. Think dachshunds, basset hounds. They're more prone to stenosis.
Okay, quite a list. It really highlights those breed links. And when would an owner or a vet typically notice something is wrong? Is it obvious from birth?
It varies. Sometimes yes, especially if the spinal cord itself is directly malformed or severely compressed. You might see neurological signs like weakness or wobbliness right from birth or soon after.
But not always.
Not always. The vertebral bone malformations themselves might be, well, silent for a while. Clinical signs often emerge later, particularly during periods of rapid growth,
When would that be, typically?
usually between about 5 and 9 months of age. The changing stresses on the spine during growth can cause instability or compression that wasn't obvious before.
Okay, so growth spurts are a key time to watch out. So what are the signs owners should look for? What might they actually see?
Well, sometimes you can see physical changes in the spine's shape. An exaggerated inward curve of the lower back, that's lordosis, sometimes called swayback,
Okay.
or an outward rounding, usually the upper back, that's kyphosis or hunchback. And then there's scoliosis, which is a sideways curve.
So visible distortions.
Yes. But often, the more significant signs are neurological, resulting from that spinal cord pressure.
Yeah.
The main ones are ataxia that's in coordination, a wobbly or unsteady gait.
Like they're drunk.
Kind of, yeah. And paresis, which is weakness in the limbs. It could be mild weakness or progress to paralysis.
And does it matter where the problem is?
Absolutely. The signs you see depend very much on which part of the spinal cord is affected.
Yeah.
A problem in the neck will look different from one in the lower back, affecting front legs, back legs, or all four.
Right, that makes sense. We've touched on genetics being a big factor, but you mentioned it's complex. What else might contribute to these malformations developing?
Well, while those breed-related inherited defects are really strongly suspected, especially for things like hemivertebrae and bulldogs, the sources do suggest it's often not just one gene. It's likely polygenic multiple genes interacting.
Okay.
And environmental factors during pregnancy are also thought to potentially play a role.
Environmental, like what?
Things the mother might be exposed to. Teratogens, those are substances known to cause birth defects. Toxins. Even potentially nutritional deficiencies in the mother's diet during that critical developmental window.
So things in the environment could interact with a genetic predisposition.
Possibly, yeah. Or maybe even cause issues independently in some cases. It could help explain why sometimes these things pop up unexpectedly, maybe without a clear family history. Maternal stress during gestation is also mentioned as a potential, though maybe less defined, risk factor.
It really underscores how sensitive that developmental period is. Okay, so let's say a vet suspects one of these congenital issues. How do they actually confirm it? What's the diagnostic process?
Right. Well, first they need to rule out other things that could cause similar signs.
Like what kind of things?
Oh, metabolic diseases, other nutritional problems that develop after birth, infections or inflammation of the spine or spinal cord, exposure to certain toxins post-birth, or even trauma, an injury.
So differential diagnoses are important.
Vary. Standard blood work and maybe a urinalysis are usually run. Typically, these are normal in cases of just congenital malformations, so normal results help point away from metabolic or infectious causes.
Oh, okay, so blood tests help rule things out. What about actually seeing the problem? Imaging must be key.
Absolutely essential. Imaging is where you really find the answers. Standard X-rays or radiographs are often the first step.
What can they show?
They're great for looking at the bones. They can clearly show vertebral malformations like hemivertebrae or block vertebrae, and also any overall spinal curvature like scoliosis.
But can they show if the spinal cord is being squeezed?
Not directly. For that, you often need more advanced techniques. Myelography used to be common where they inject contrast dye around the spinal cord before taking X-rays.
Right, to outline the cord.
Exactly. It can show where the cord is being pinched, but the texts mention being cautious with myelography, especially if the spine might be unstable. Manipulating the animal for the procedure could potentially worsen things.
Okay, so what are the alternatives now?
CT scans are much better for bone detail. Sometimes they do CT myelography, combining the CT scan with that contrast dye, which gives really good 3D views of the bones in the compressed cord.
Okay.
But really, MRI is often the gold standard now,
Why MRI?
because it's fantastic for looking at soft tissues. So it doesn't just show the bones. It shows the spinal cord itself, the nerve roots, the discs, ligaments. You can see bruising or swelling in the cord, those fluid cavities like syringomyelia, much better than with other methods.
So MRI gives the most complete picture.
Generally, yes, for assessing the spinal cord itself. Sometimes a cerebrospinal fluid analysis, a CSF tap, might be done too, mainly to help rule out inflammatory or infectious diseases if there's still uncertainty.
Okay, so quite a diagnostic toolkit available. When they do these tests, especially the imaging, what kind of specific abnormalities or pathologic findings do they typically see with these conditions?
Well, one thing the sources mention is that it's actually pretty common to find multiple different malformations in the same animal. It might not just be one hemivertebra, for example.
Ah, so a combination of issues.
Yes. And then the findings really depend on if and how the spinal cord is being compressed. If it's acute compression, like with a sudden instability.
Like in the atlantoaxial subluxation, maybe?
Exactly. You might see signs of ischemia, lack of blood flow hemorrhage, so bleeding into or around the cord, swelling of the myelin sheath around the nerves, and damage to the nerve fibers, the axons.
Ouch. And if it's more of a long-term chronic compression?
Then the changes look different. You're more likely to see degeneration of that myelin gliosis, which is like scarring in the nervous tissue, and maybe fibrosis, more scar tissue formation. The cord might even atrophy or shrink over time.
So long-term pressure causes wear and tear, essentially.
Basically, yes.
Yeah.
And you also see chronic changes in the surrounding structures due to the instability or abnormal forces. Things like bony proliferation, which is extra bone growth, thickening of the joint capsules between vertebrae, and ligaments getting thicker too, all contributing to narrowing the space.
Right. Can we revisit some specific conditions? Like, what are the key pathological findings for atlantotal subluxation?
For AA subluxation, the core issue pathologically is usually the congenital absence aplasia or underdevelopment hypoplasia of that odontoid process, the peg on the C2 vertebra. Or sometimes the ligaments that are supposed to hold it in place are faulty.
Okay. What about those occipitoplantoaxial malformations?
That's often things like the Atlas C1 being fused to the skull, seen sometimes in cats or in dogs. The dens, that odontoid process again, might be angled abnormally. There's also occipital dysplasia, where the back of the skull itself hasn't formed completely over the cerebellum.
And sacrococcygeal dysgenesis? We know it's absence of lower vertebrae.
Yes, pathologically, it's the absence or underdevelopment of those caudal vertebrae. Pretty straightforward.
Okay. And spina bifida. What are the key things seen there, pathologically speaking?
The hallmark is that incomplete fusion of the vertebral arch, most often, as we said, in the lumbosacral area, the lower back. You might see the protrusion, the meningocele or meningomyelocele.
The bulb.
The bulge, yes. And often associated internal findings like myelodysplasia, The abnormal spinal cord tissue defects in the central canal, maybe syringomyelia, hydromyelia, those cavities, and other abnormalities in the gray matter structure.
Lots going on potentially. And finally, spinal stenosis.
With congenital spinal stenosis, the pathological findings within the spinal cord itself are usually those chronic compressive changes we talked about, the degeneration, the gliosis resulting from that persistently narrow canal.
Got it. It's a wide spectrum of issues. So, moving on to treatment. If an animal gets diagnosed, what can actually be done?
Well, it really, really depends on the severity of the neurological signs.
How so?
If an animal has, say, a hemivertebra found accidentally on an X-ray but has no neurological problems, you might just monitor them carefully, maybe manage them as an outpatient.
Okay. But if there are signs,
If there are significant signs, moderate to severe weakness, paralysis, maybe severe pain, or a condition like unstable AA subluxation, then hospitalization and often surgery becomes necessary, sometimes even emergency surgery.
so it ranges from monitoring to emergency intervention.
Exactly. And supportive care is crucial regardless. Things like strict rest or activity restriction initially, especially after surgery. Physical therapy can be really important to maintain muscle tone and function.
Rehabilitation.
Yeah, rehab. Sometimes mobility carts are needed for animals with permanent paralysis. And managing bladder and bowel function is vital if they've lost control, preventing urine scald, bladder infections, constipation.
That sounds like a lot of nursing care.
It can be, yes. Diet is also mentioned. Keeping the animal at a lean body weight is important to minimize stress on the abnormal spine.
That makes sense. And what about owner education? Seems critical here.
Absolutely critical. Owners need to understand, that even if things seem okay now, problems could arise later, especially with growth. They need to know what signs to watch for
Right.
and understand that if neurological signs do appear, a full workup is needed. And of course, discussing the heritability aspect, the implications for breeding that animal or its relatives is a really important, sometimes difficult conversation.
Yeah, I bet.
And owners need realistic expectations. Sadly, the sources note that without treatment, especially for moderate to severe neurological problems, the outcome is often poor, sometimes leading to euthanasia. But early surgery can make a big difference.
Okay, so surgery is often the main course of action for compression.
For significant compression causing neurological signs, yes. The goal is usually decompression, making more space for the spinal cord.
How do they do that?
Depends on the problem. Removing part of the vertebral arch, maybe removing disc material if that's involved. However, the texts do caution that if the compression has been really severe or chronic, the spinal cord might already have irreversible damage, so surgery might stabilize things but not fully restore function.
Okay. What about specific surgeries, like for AA subluxation?
For AA subluxation, a common approach is ventral stabilization. They go in from underneath the neck, sometimes decompress the cord, and then fuse or stabilize the C1 and C2 vertebrae together using pins, screws, bone cement, plates, various implants.
Stop that instability.
Exactly. And for spina bifida, if there's just a meningocele, the sac with fluid and meninges, but no nerve tissue, sometimes surgery could be done to close the defect, remove the sac, to prevent CSF leakage and infection risk.
But not if the cord itself is involved.
Generally not, no.
Yeah.
If the spinal cord tissue is in the bulge, surgery is usually considered too risky and unlikely to improve function, unfortunately.
Understood. What about medications? Do they play much of a role?
Corticosteroids, like prednisone, are sometimes used. The idea is to reduce inflammation and swelling around the spinal cord.
Do they work?
The sources suggest their effectiveness is, well, questionable or variable in these specific congenital cases. And they come with downsides, right? Potential side effects like stomach ulcers, increased infection risk, potentially hindering bone growth in young animals. They're contraindicated if there's an infection. Plus, they can interfere with vaccine responses, so often used cautiously, if at all.
So maybe a temporary measure, but not a fix for the underlying compression.
Pretty much, yeah. Surgery is usually needed for the mechanical problem.
Okay. So looking ahead then, what's the long-term picture? Follow-up, prevention, prognosis. What can owners expect?
Long-term monitoring is definitely important. Regular neuroexams are key, especially in growing animals, to catch any deterioration early. Sometimes repeat imaging might be needed to check stability or surgical sites.
And prevention. Mostly about breeding, I guess.
Primarily, yes. Given the strong suspicion of heritability for many of these, the main advice is not to breed affected animals. Responsible breeding practices are crucial to reduce the incidence in predisposed breeds.
Makes sense. What about potential complications down the line?
Complications depend on the specific issue. With AA subluxation, even with treatment, There's always a risk of sudden worsening or even acute death if stabilization fails or severe cord damage occurs. With surgery in general, there are risks like implant failure, infection, ongoing instability, or failure of the neurological signs to improve.
Okay. And the overall prognosis, it sounds like it varies a lot.
It really does. For, say, a vertebral malformation like a hemivertebra that's found incidentally and isn't causing any spinal cord compression, the prognosis is generally good. They might just live with it.
That's good news for some.
Yes. For Atlantic axial subluxation that's treated successfully with surgery, prognosis is often fair to good, depending on the pre-op neurostatus. If there's spinal cord compression from other malformations that's treated surgically, again, often considered fair, but depends heavily on the severity and duration of compression before surgery.
And the less positive outcomes.
Unfortunately, for conditions like severe spina bifida with significant spinal cord involvement, especially if it causes incontinence, the prognosis is often poor to grave, even with supportive care. The sources really emphasize that sums it up well, yes.
Well, we've certainly covered a lot of complex information today, digging into these congenital, spinal, and vertebral malformations.
We really have. And I think the key takeaway is just how diverse these conditions are. They often seem to stem from that complex mix of genetics, maybe with some environmental factors sprinkled in during development.
Yeah, and recognizing those predispositions seems really important, alongside being alert for any subtle signs, especially during those growth phases.
Absolutely. And knowing the diagnostic tools we have now, like MRI and the range of treatment options, particularly surgery for compression, is vital. But it's also crucial to have realistic expectations about the prognosis, which, as we've discussed, can really vary.
It definitely paints a complex picture, and it leaves us with something to think about, doesn't it? Considering the complexity and the potential heritability of many of these conditions, what broader ethical considerations does this raise, perhaps in fields like animal breeding or even genetic research? Something for you, our listener, to ponder.
A very relevant question indeed.
Thank you for joining us for this deep dive today.